Hi, I'm Dr. Sam Lamb. I'm the chair for Berlin coming up for the ISHRS World Congress. We're here with Piotr Turkowski and Nina Otberg, and they are amazing at running a new session that we're going to be doing, a panel on scarring alopecia. Peter, can you tell me a little bit about this panel that we have coming up?
We have panel to discuss frontal fibrosis and alopecia, how to treat it first, how to do it head secondly, and all of these areas. We have some amazing abstract you can hear on our Congress.
And Nina, can you tell me a little bit how you're structuring or planning to structure this panel?
Yeah, well, first of all, we have a panel of world experts in cicatricial alopecia. We have Dr. Ulrike Blumen-Pitavi from Berlin. She's a professor for dermatology at the University Clinic. We have Dr. David Sakita from Madrid. He is specialized in FFA. He's a dermatologist. And we have Lorena Wiesenthiner from Brazil. She is famous for her approach in this surgical approach and regenerative medicine. We also have Nadia Sheklashvili from Georgia. She's also a dermatologist with a specialization in scalp disorders, and also Dr. Sarah Alenzini. She's from Kuwait, also dermatologist specialized in hair diseases. And we would like to structure it so that we can all have an interesting discussion on how to approach these difficult diseases. For example, how to approach them with medical therapy, when to operate and when not to operate.
That's awesome. I heard a little discussion about possible case studies or lectures. Are you going to have a blend of lectures with panel discussions, or what is your intention right now?
We are not planning to have lectures. We kind of wanted to present cases, just pictures of certain diseases, and then every panel member will be asked how to approach or how he or she would approach this patient.
And what are the certain diseases you're thinking about right now? Obviously FFA, which David Saseda is going to be talking about, and Ulrike Blumen-Pitavi is also a keynote. She's going to be talking about topical finasteride, but obviously she's a very qualified dermatologist and has amazing experience dealing with scarring alopecia as well. Are you going to cover, do you have a lot of CCCA in Germany? Is there a lot of Black population?
Not so much CCCA, but a lot of LPP. We can also discuss discoid lupus and also, scars in general, how to approach them and what kind of scarring we see. I also would like to talk a little bit about folliculitis decalvans.
Yes. Because
this has always been a contraindication for surgery, but there are some publications on surgery on folliculitis decalvans.
That's going to be an amazing section. I think this is a topic that everyone needs to hear about. So it's going to be following David Saseda's keynote on FFA, where he's going to go into quite a bit of detail for about 20 minutes. And then we have the ability to have him part of this whole discussion. And just as a tease as well, on Saturday morning, before I forget, we're going to have a coffee with the experts where we'll actually have Peter and Nina there, as well as some of the panelists, if we can get them, to really field questions one-on-one with you as well. Tell me a little bit, Nina, and we'll see if Peter, if we have the connection well enough to try to continue this conversation with him. But Nina, let me just ask you a question. For FFA, let's talk about one of the most common conditions. Are you biopsying it? Do you just read it by clinical activity combination before you decide if they're safe for surgery? How do you decide if someone has burned out disease?
Well, the question is it ever going to burn out? That's the first question. I don't biopsy frontal fibrosing because I feel that the scar eventually shows. I use trichoscopy to diagnose it and the clinical presentation. I have a plan where I do like a treatment plan. When it doesn't look inflamed, I just use topical therapy. If it's inflamed, I use intralesional therapy. And if that's not working, I add oral therapy, like systemic therapy.
What oral therapy do you use?
Oral therapy can be chloroquine or low-dose antibiotics sometimes. And that can be quite effective. So I would say hydroxychloroquine is my first choice.
And do you add the antibiotics as a second line then instead of a first line?
Well, it's either antibiotics or hydroxychloroquine. And then recently I've added also ruxolitinib to the regimen. It's unfortunate that it's really expensive, but ever since I added it to the regimen, I feel it really makes a big difference.
And are you doing that in lieu of the chloroquine, or are you doing it as a first line now, or if they can afford it?
I would say step one is always topical, like protopic and steroids, so corticosteroids. And then if they can afford it, also the ruxolitinib. And then if that's not enough, then I'm adding therapy, like
And that's just for the audience member, that's a JAK inhibitor, the first one, right, that we're talking about?
Yes.
Yeah, so that's going to be, David's going to be covering some of that as well. So that's going to be fascinating. I think that's frontier. So Peter, what do you do in FFA cases? How do you manage it medically?
Medically, first of all, we because in our clinic we have parts. So if we have FFA patient, we send him to the dermatologist, yes, and we treat them like antibiotics, and we keep them in silent at least 12 to 18 months without symptoms of FFA. I mean, and later on we do it tests, like to put small amount of hairs, yes, to see if everything is good. And if it's good, after that we decided to do a second head transplant, because sometimes we can see that after some cases the graft didn't survive or even makes worse. And in this case we didn't do it. But usually if we have been silent like 18 to 24 months, we do it large session of head transplant.
Perfect. And Nina, I know that you mentioned that, and it's a very sage comment, that really it never burns out. But what is your time period for clinical quiescence before you decide to intervene? And do you also do test grafts before you try to do a full session?
I always do a test area. Usually I operate here on both sides so that it doesn't look odd if we don't do another session. I personally never had a case where the transplant made it worse, but I had cases where it didn't turn out to be so great. My feeling is that the patients are usually very happy, even if I'm not happy, because they have a little bit of more hair. I also usually wait at least a year to see if the inflammation comes down. If I feel that it's still very inflamed, I don't operate. I don't recommend it.
And if it's not inflamed, would you would you insist that they continue their medical therapy afterwards to make sure the grafts don't fail? Yes. Okay. And Peter, did you have something to add?
How about the patient to come, like, because we have some patients who want to do it surgery faster, and in some case, for instance, 12 months, if they want to try, we can try to do it like head transplant, but later on we keep on with dermatologist session, and also we have good effect. But I want to ask you, what kind of the result do you have in long term after FFA?
What are your results long term, Nina, with FFA in terms of failure or survival?
It differs. I have some excellent results that are stable for years, really beautiful, and I have some results that are gradually getting worse, and I have some results where right in the beginning the growth wasn't so great.
The one thing I learned from Denver that I thought was a pretty interesting comment was especially with women, where they don't have the option to shave their head and they're not going to go completely bald necessarily as men. And this is what I actually learned this from the Denver ISHRS last year. I tell my patients that, hey, it may die in a few years, it may die more quickly, but we could come back for another transplant. And some people just come back every few years and get a transplant. Now you can't do that with a young male, but with a more mature female that has good donor capacity, that could be the case. And I think that's sort of a brilliant advice in terms of having patients have expectations there.
We usually do, like, if we have good transplant, we have a lot of patients. Of course, FFA is quite rare in Poland still, but we usually do it one more session if we have good result, because usually we have like more advanced, the one is not enough with our patient, and we usually, if we see that the result is stable, we do it second session, and they are very, very glad after the second one.
I think that that's very wise advice, is to undersell a single transplant for a patient and try to tell them that this may take more than one, or at least the standard maybe for you, a couple sessions to get partial growth. And I think that's a very good comment.
Yes, you always on my consultation. I said that one is usually not enough because they comes to us in quite advanced stage, not like 2 or 3 centimeters. They're really 4 or 5 even in Poland, especially because they are under diagnosis.
Now, we know that grafts actually work to stimulate healing to the skin. Since you're planning on 2 stages, are you intentionally leaving gaps in your recipient area so that it can allow for the next transplant? Or are you just trying to get your optimal results and hopefully that it will happen in one session? What is your surgical plan?
My plan is first session I get as much I can to don't have like over harvesting, and during the surgery, and I estimate how much I can down. And I also ask patient if you want to do it like as much lower as we can to check, and later on we put in between more. Or sometimes if patient want to be like sure that we have good dance, we do it 2 or 3 centimeters lower, and in second session we go further. I ask the patient how he want to do it.
Perfect. Thank you so much, Peter. So bottom line, guys, I want you to come to Berlin because we're going to have an amazing meeting with Peter and Nina and in their panel. We have so many other panels. Listen to the other interviews coming up with the allogeneic hair transplant panel that I have, as well as a nutrition panel. Come to Berlin, October 23rd through 25th. Thank you, guys.
Thank you.